Hey everyone, welcome to a quick preview of our late-breaking work called Cultural Dimensions and Mental Health Technology. While technology has emerged as a great opportunity in the mental health space, it often does not reflect on the cultural variances of mental health experiences. So in our study, we want to explore how culture impacts mental health help seeking and how it influences technology design. To do so, we leverage Hofstede's 5 cultural dimensions of individualism, power distance, time orientation, masculinity, and uncertainty avoidance. Hofstede's cultural dimensions are an established framework to describe the culture of a country based on its cultural values. Specifically, we conducted a systematic literature review across the medical and design fields to find previous work which utilized Hofstede's framework to describe cultural differences in care. We started out with the initial selection of 150 papers. 2 of the authors reviewed each of the papers independently and evaluated their relevance based on the title and abstract. This left us with 43 relevant papers, and we employed backward situation to get to our final amount of 72 papers relevant for our review. We synthesized all of the findings for each of the dimensions and created cultural dimension tables. Each of the dimensions had specific themes and areas, such as for uncertainty avoidance, which had an evident impact on e-trust, acceptance towards innovation, but also proactiveness, whereas the dimension of time orientation influences things such as willingness towards preventive care, habits, tradition, and social network. For example, people who have a high uncertainty avoidance tend to have low trust in technology and innovation, whereas people with low uncertainty are much more open to it. For the dimension of individualism, we found that it influences family involvement, but also the communication between the doctor and patient. Power distance seems to influence a lot how the relationship and collaboration between the doctor and patient looks like and what the expectations are. The dimension of masculinity is the least explored one, which led us to finding only minimal relevant findings around attitudes toward mental health and treatment options. Our findings reveal that cultural nuances and the cultural dimensions shape individuals' help-seeking approaches, self-disclosure, preferences, underscoring the need for integrating culture more systematically in technology. In our paper, we present design consideration for each of the dimensions. However, they are intended to support deeper reflection and ideation rather than serve as a definite solution. Our research also shows that utilizing such a framework does make culture more tangible. If you want to hear more about our work, please come to our poster presentation or read our paper.